G'day everyone, welcome back to another episode of the Dental Debrief, the podcast where we talk about everything dentistry. I'm Tim, this is my best mate Maheer. We run our clinic Azure Dental out of Inglewood in Perth, Western Australia, and today we're going to talk about how diet affects oral health. So Maheer, how exactly does the food we eat impact our teeth?
So there's the obvious ones like sugars and acid and things like that. But I think the new one that we're talking about a bit more is soft diets and how they've contributed to our crowding, our malocclusion, our orthodontic problems. So a lot of these come from, as diets with our modern diets become really soft now, we're not stimulating the muscles as much, and it's not developing those bones, developing the palate, the airway, the nose, the way it used to. And that poor development is now actually contributing to a lot of the teeth crowding that your little guy's fixing a lot.
I think the other thing is obviously like the sugar. When you look at skulls from 100,000 years ago, there just wasn't tooth decay, whereas now there is, and it's because of that change in diet that's not necessarily natural, which is the highly processed sugars, fast food, and fizzy drinks and all that sort of stuff.
Yeah, exactly. The sugars that are dissolved, because diet, sugars in fruit, and that would come with fiber, and that would be a bit more natural, and they'd pass through, and they'd be very limiting on how much sugar you could eat because the fiber would just fill you up. But now we've got these refined sugars dissolved in liquids that get into the grooves of the teeth, or they get in between the teeth, and that's where we've seen the tooth decay.
That's it. Cave people didn't have Coke, eh?
Tim, have you had any patients that have just got severe problems and you could just pinpoint it to their diet?
I mean, pretty much every patient who comes in with a lot of decay, it's always like really high sugar consumption. But like, it's not necessarily obvious. A lot of patients will say, I don't have any sugar, I don't snack. But they're having, say, 6 or 7 coffees a day with sugar dissolved in it. And a lot of people don't realize that it's not about how much sugar you have. Like, you could have a kilogram of sugar for breakfast, lunch, and dinner and probably not get decay. It's the person who has a jelly bean every half an hour because they're constantly putting sugar in the mouth. The bacteria don't care whether it's a kilogram of sugar or a teaspoon of sugar. It's still a heap of sugar for the bacteria. So what's really important is how frequently throughout the day you're having it. So I tend to find the people who get decay, they're the snackers who are constantly in the fridge or in the pantry getting a new snack every sort of 20, 30 minutes. Yeah.
And I'll just add to that, and they don't let the mouth and the environment take over and start sort of repairing. There's no time for repair or resetting. It's just constant attack, sugar attack or acidic attack, and that wears down that dentition.
Yeah, so they say every time you eat sugar, your mouth becomes acidic for half an hour, and your mouth can tolerate about an hour and a half to 2 hours of acidity a day. So out of 24 hours in a day, you can tolerate sort of 3 or 4 meals potentially containing sugar. Yeah. But when you add in sort of 7, 8, 9, 10 sugar exposures throughout the day, your teeth's in an acidic state for hours and hours and hours, and it just can't repair. The saliva can't repair it fast enough.
Exactly. How do we sort of reset and help against these sugar attacks? Should we be brushing our teeth straight after having some sugar?
Yeah, so the classic one is that after you've had sugar, your teeth are going to be surrounded by acidity, and they're going to become a bit softer for about half an hour. And it takes about half an hour for the saliva to sort of harden the teeth up again because your saliva is full of calcium and phosphate. So if you go and scrub your teeth during that time when they're softer, you're actually going to take more enamel away. So that's why we say after you've eaten something containing sugar, you should rinse your mouth with water and do something to stimulate your saliva. So the best thing to do is to chew sugar-free gum because it's going to get your saliva going. It's sweet. The chewing action, it all gets the saliva going, and that's what's going to repair the teeth. So we say if you've had like an acidic drink or you've had sugar, wait half an hour before brushing your teeth. But I don't think you need to brush after every meal. I think you just need to rinse with water, chew some gum for 20 minutes, and you're fine.
And it's not the sugar that's making the holes and the decay and the problems, it's the bacteria. So if you don't have bacteria, the sugar is much less effective in doing the damage, but the sugar feeds that bad bacteria that creates the acids that makes the decay.
Yeah. But here for you, have you had any patients with severe dental problems that were caused by their diet?
Yeah, as you mentioned, it's always like the snackers. There's the little old ladies that are in their social groups and they're just having teas, but they're having lots of tea throughout the day with a little biscuit here and there. But then when you look at the day, they're having about 6 or 7 sugars in their tea plus a little snack, and they just find they have so much plaque and they already have lots of dental work. So the dental work's failing, and it's usually because of that just a little attack of sugar every half an hour, every hour, which is, you don't even notice, you're just having a little sip of tea during the day on a cold winter's day or something. But if it has sugar in it, it's feeding the bugs.
It's the same with kids. I've had like a little 6-year-old who had decay in like all of her back teeth, and her mum was saying, but she never has any like processed food or any of that sort of stuff. But she was eating a lot of fruit. Now, fruit I think is good in general, but she was sitting in class all day just snacking on blueberries. So it's just constant. So of course fruit has sugar in it. It's just much less potent than it is in a processed food. But still, if you're eating it all day, every day, you're going to end up with cavities. So I think even with fruit, you've got to be sensible. You can't just be snacking on it all day long. Yeah, so Maheer, how do you approach your diet, like personally, to maximize your oral health?
For me, definitely like high acidity drinks, energy drinks. I really don't drink many soft drinks or anything like that. I do enjoy a bit of chocolate. Chocolate's probably my vice.
Yeah, I can attest to
You've
that.
probably seen that, but
Man likes
I
chocolate.
love chocolate. But I don't snack on it. I have it all in kind of one go, usually after dinner or before dinner or something. So I'm pretty on top of it, and my plaque control is really under control as well. So that's how I manage. But I'm a vegetarian. I eat healthy. I exercise a lot. Drink lots of water. All that kind of stuff. So that baseline general health protects my teeth. How about you, Tim?
Yeah, so I'm pretty much like zero sugar, except for a small amount of fruit. So I've got a lot of fillings in my mouth from life before dentistry. I mean, I started studying dentistry when I was 23. So there was a brief period there in my life where I wasn't a dentist. When I was 17, I had like 14 fillings done, and it was from really, really high sugar. And a lot of them were really deep fillings as well. So I made the decision that, look, if I'm going to continue eating sugar, like I'm going to lose teeth because these are really, really big fillings. So I just made the call zero sugar. And I just, I still drink a bit of soft drink, but I drink like Pepsi Max with artificial sweetener. I think like there's pros and cons with that as well. But yeah, I've essentially like taken sugar out of my diet, and I reckon it was the best thing I ever did. Yeah.
Just for your overall well-being and
yeah,
focus
overall
and
health.
work.
I think sugar's worse than fat. I think sugar is the cause of a lot of the health problems. Not
Especially that refined sugar.
yeah, not just dietary, but obviously heart disease, diabetes. Generally like increased inflammation from high sugar diet.
There's heaps of research to support that.
Yeah, I think low sugar is the way to go, just for your general health as well. Yeah. Here, I'm just going to throw some foods out there for you. I just want you to tell me whether they're friend or foe for your oral health.
Done deal.
Apples,
Friend.
coffee,
Foe.
cheese,
Friend.
soda,
Foe.
almonds.
Friend.
Yeah.
So Tim, I'm going to quick fire a couple of foods. You're going to tell me friend or foe for your oral health.
Let's do it.
Alrighty. Carrots.
Friend.
Dried fruit.
Foe.
Green tea.
Friend.
Ice.
Foe.
Oranges.
Friend.
Yeah, that's a tough one.
Yeah.
Depends. So oranges can be quite acidic, right? And especially if you have those people that like they suck on lemons or they suck on oranges.
I know.
So much erosion.
Exactly. But vitamin C is great for your gums and it's good for your overall health. So I think in moderation.
Thank you for listening to our latest episode of the Dental Debrief. I'm Maheer. This is my best mate Tim. If you have any questions about what we've talked about today or a future episode and you have some ideas, let us know. Drop us a comment. We'd love to hear from you.